Well, a stroke, by definition, is a sudden neurological deficit. And the most common type is what's called an ischemic stroke. You can have several varieties of strokes, including hemorrhagic, which means there's some bleeding involved. And then there's also some other neurological symptoms that can masquerade as a stroke, like seizures, for instance, which can be caused by structural problems like tumors or infections, but also sometimes just an irritated part of the brain, which isn't associated with any malignancies or any problems. So oftentimes you can't quite tell. But the most common type of a stroke, which is a sudden neurological change, is a ischemic stroke. An ischemic stroke, what that means is there's a sudden interruption of blood flow in a major artery in the brain, which leads to brain dysfunction. Sometimes that's reversible, sometimes that's permanent. It depends on how fast it's treated. In terms of hemorrhagic strokes, what that means is the smaller, much finer blood vessels in the brain rupture. And this leads to the cessation or stoppage of normal blood flow to the brain, which also leads to brain dysfunction.